Further debate, the member for Oshawa.
Thank you, Speaker, and I am grateful to be here to stand in this legislature on behalf of the people of Oshawa and Durham Region, especially today on PSW Appreciation Day, as we stand together in the face of COVID-19 and call on this government to join the official opposition and families across Ontario and agree to an independent public inquiry into long-term care in Ontario. Speaker, Hillsdale Terraces in Oshawa was one of the first long-term care homes in Ontario to declare an outbreak, and I'm very glad and grateful that the outbreak has officially been declared over. But our community lost 14 loved ones, and we continue to mourn. Unfortunately, there is an outbreak that is not over at Orchard Villa Long-Term Care Home in Pickering. There have been at least 72 deaths and 225 positive cases among residents at the home operated by Southbridge Care Homes. Another 96 staff members at the facility had also tested positive for the virus. The community heartbreak is turning to outrage, though. The City of Pickering has called for an investigation into the outbreaks and deaths, and the official opposition publicly has supported them in this call. And since the beginning of this pandemic, my office, and I'm sure all of our offices, have been hearing from families wanting a thorough investigation into what is going on in long-term care. I spoke to Andrew Watt last week, and he told me I could share his mother's story because it would be nice to have people hear her name. Well, Speaker, her name was Nina Watt. Andrew's 86-year-old mother, Nina, had spent months at the hospital in Oshawa and then was transferred to Orchard Villa. She didn't live there long before she caught COVID and died on April 15th. There could only have been a few of them at the funeral, standing far apart. Andrew said it was so surreal. He told me her casket was open. She looked like she'd been through hell. The funeral didn't last long, and then they went to the gravesite, and he shared that it was very nice to hear birds and a wind chime. He said, "My mom would have liked that." I know that my colleagues in this legislature will sincerely extend their condolences, but Andrew and his wife Janice want to know what happened. They want to know the answers to all the questions families have about their loved ones who were trapped in Orchard Villa and got sick. As Andrew said, quote, "She got sick so fast the virus wasn't confined." And they want to know how it could get so bad that the military had to be brought in. And yesterday, Speaker, to add insult to injury, Nina's family heard from a family member of a different senior at Orchard Villa that they had wrongly been given Nina's personal pictures and effects. That's awful. So I want to know if the Premier or the Minister would like to know what's been happening at Orchard Villa in Pickering. Nina's family wants an inquiry. Grieving families want an inquiry. The community wants an inquiry. The official opposition has formally asked, and today we've put forward a motion before this legislature for the government to agree to a formal, independent, public inquiry into what has gone wrong at long-term care homes across the province, like Orchard Villa. Orchard Villa is a private long-term care facility, and a reminder for the folks at home, private businesses have profit margins and stakeholders. So while they get public dollars from taxpayers to ostensibly provide care in the long term, that money leaks out into private pockets and cannot go as far. That's how it works, or clearly how it doesn't work, and I would argue never has. This Minister of Long-Term Care has pushed for years during her medical career to expand private health care, championing hybrid health care. And she and many others connected to this government, like former PC Premier Mike Harris, have been working diligently for years to redirect public investment dollars into private investor pockets. But, Speaker, this government wants to effectively investigate itself with a government-controlled commission and says it will be fine and says that we should trust them. Well, Speaker, I have some things I'd like to share. The chair of the Board of Directors of Chartwell Retirement Residences, a major corporation profiting from senior living, is former PC Premier Mike Harris. And a lobbyist for Crescent Care, the owner of 15 private long-term care homes in Ontario, was the deputy campaign manager for the now Premier's 2018 election campaign, Patrick Tuns. And the CEO of Ontario's Long-Term Care Association is Donna Duncan, who was the policy director to the PC leader back from 2006-2007. And most recently, a registered lobbyist for Ontario Long-Term Care Association is Andrew Brander, who up until July 2019 was the Director of Communications for the Minister of Finance in his Premier's government. So when they tell me to trust them, that it'll be fine, that they're going to do all the right things, okay, I'm to take your word for it? Speaker, perhaps the fact that a few fat cats in the private long-term care world happen to be snug with Doug is unrelated to the fact that this government is trying super hard to wriggle out of its public inquiry.
I'm going to ask the member to refer to other members in the House by either their riding name or their ministerial name, as if applicable.
And thank you, Speaker. I will remember that. But I wonder if that has anything to do with the fact that this government is trying very hard to wriggle out of an independent public inquiry into long-term care. Perhaps. And during this pandemic, we have lost almost 2,000 loved ones in long-term care in Ontario. I wish more of our money could have stayed in the system and gone to cleanliness and care and wages and compassion, and I wonder where we might be today. Because today, Ontario's folks and families are grieving, and we may never heal. Speaker, here's a letter sent to me by Sandra Hetherington of Guelph. She says, quote, "I'm writing in support of having the government call for a public inquiry into the disastrous, shameful and sad state of affairs in long-term care homes in Ontario. My husband has advanced Parkinson's and is legally blind. He is a resident of Riverside Glen in Guelph, Ontario. I know the government pays out a huge amount of money to the owners of these care homes, and I myself pay $2,800 a month to Riverside Glen for his care. The COVID pandemic has made things so much worse, even in the best of homes, as we family members are shut out, reduced to trying to get a glimpse of our family member through a window and leaving our loved one wondering why they have been deserted. I can't even imagine what went on in these other homes where the virus was rampant and deadly and family members never even got the chance to hug their husband, wife, mother, father, etc., and say goodbye before they died. As a wife and caregiver, my heart goes out to each and every person involved in this tragedy, from patient to family to nurses and PSWs. Perhaps, God willing, society will stand tall and demand that our government do right by our seniors and see that they get the resources and proper care that they need in the twilight of their years. We can only hope and pray that this will come to pass." I thank Sandra for her letter. Speaker, I got many other letters asking specific questions that may or may not be answered by a government-controlled inquiry, questions that may or may not, if they are answered by the government's government-controlled commission, ever come to light, if they so choose. And the minister's argument that it takes too long to have an independent public inquiry does not hold water when you can fix what you find on any given day. A day like today. A day like today that is Personal Support Worker Appreciation Day, for goodness sakes. Nothing is stopping you, even if you pretend that we are, nothing is stopping you from paying them fairly, ensuring that they have full-time hours with benefits, or that there are enough of them to care for vulnerable seniors. Nothing is stopping you, and you haven't done that today, despite our calls for years. We have already identified these issues, so fix them. Don't pretend we're stopping you or anyone else. Get out of your own way and do something. And Speaker, as far as an independent public inquiry, we want something out of their hands. Because anything worth doing is worth doing well, and this government has been saying, well, you're not the boss of me, we'll do it our way. Well, you know what? A government-controlled commission is what you want, is what the government wants. That is what the private seniors care companies want. It's not what families want or deserve, and families want a fair inquiry where government doesn't pick the folks, doesn't pick the terms of reference, doesn't pick the back room, and doesn't pick the secret knock. So, I would ask that this government support the call for an independent public inquiry, one that the public will trust and will make us better and really respect the seniors. Thank you.